in Iowa.
Mm.
And the population in Iowa definitely does not look like the population in Reynoldsburg or Whitehall or Columbus City Schools.
Right.
So that's another challenge where like the information that we're collecting and the evidence that we have is not representative of all of the populations we need to be working with. And there have been multiple times in that program where people were just like, oh, these are all white people and this kind of like demo that we're learning from, and they can't make a connection with that. And I think sometimes the public health messaging is the same way, where it doesn't recognize, the mistrust, the trauma, the level of poverty, and all of that. And it's just like, oh, don't do drugs, or, I
Mhm.
just, I think that's very important to have more culturally specific and sensitive messaging. And it has been a huge challenge for public health authorities to try to be able to connect with different populations. Um, so those efforts are definitely happening. I just hope that they can be more culturally specific and that they can resonate with people who need to hear the message, because it's not one size fits all. Like, not everyone has the same path to addiction, and not everyone who has an addiction has the same path to recovery.
Right.
And the more diverse our workforce can be, and the more representative our research can be and our tools can be, the more effective we can be in our community. So there's a lot of different levels of barriers I see in our different systems, and they're primarily related to equity issues, in my opinion. So
Well, and I appreciate you saying it, because when I think about it, especially when you talk about a curriculum that was maybe based upon young people in Iowa versus, again, urban America, especially if you look at
yeah,
like Hall, Reynoldsburg, or even Columbus City Schools. you know, I think one of the challenges that a lot of individuals would suggest is that sometimes it's our access to resources. You know,
mm-hmm.
sometimes we're not only blocked based upon not being able to relate to the curriculum that you just pointed out, but accessibility, even from a financial standpoint, or our economic status standpoint, that I can only imagine in your more suburban areas, where the income levels are a little bit higher,
Yep,
being able to access certain type of programs or certain types of maybe centers or treatment programs. Whereas from an urban perspective, here's one of the challenges that I've seen, and is that even from a pastoral perspective, that it's not as though we're unfamiliar with addiction.
mm-hmm.
We're familiar to a degree, whether or not it's alcohol or maybe some other types of
Mm-hmm.
addictive natures, but we're familiar. So that young kid is not their first rodeo. Let me put it
Mm-hmm.
that. They may have seen addiction, and so that family's approach to maybe past circumstances, again, of
Definitely.
addiction in their community, may have been a lighthearted approach because of accessibility to resources.
Yes.
And so,
Absolutely.
you know,
And you bring up a very good point about accessibility, because in our county, there are areas where if you're in recovery, you would have a harder time getting, especially if you're in recovery for opioid use disorder, you would have a harder time getting to a certain location to get your medicine to
mhm,
help you with your symptoms and stuff like that. So, and OSU has like mapped all of this out and shared it with people. So there are definitely these areas that we call recovery deserts, where
mhm,
there aren't enough resources for the amount of people, and also transportation necessary for people to be able to get to their appointments or support groups and that kind of stuff. So the access to resources always a huge problem in healthcare.
right. And that becomes some of the challenges in terms of being able to cope with those individuals around us who are dealing with addiction. The ability to be able to access these resources, but also I think, and two, one thing that urban America has looked at is sometimes the criminalization that surrounds addiction. I
Definitely.
mean, we are seeing a new trend where the criminal justice system is approaching, and they're approaching it from the right perspective. They're going, hey, these behaviors are not necessarily criminal. They're coming out of addiction, so we're creating programs,
Yeah.
but disproportionately, unfortunately, persons of color may have gone had gone down a criminal route, or at
Yes,
least be convicted down
absolutely.
a criminal route, and not giving that opportunity for those
Exactly. Yes,
programs.
it's kind of, I mean, I agree with you and I'm very hopeful about the changes too, but sometimes I think it's too little too late, just because of the reason that you brought up that, we're focusing on what's happening now and we're trying to change our systems and have them be more compassionate, but also more scientific. Because like you said, if you have an addiction and you commit a crime that's related to your addiction, that is a crime that is motivated by disease,
Right.
and without that understanding and acceptance, we're going to continue to criminalize people who we should be providing treatment and supportive services to.
Exactly.
And and I agree with you that there are really good trends, but sometimes I'm overwhelmed by like how little is actually happening given what has happened for hundreds of years.
Yeah. Yeah.
and how that has been very targeted at
Mm.
specific communities, and thinking about reversing that, to
Mhm.
me it's not like, oh, $1 million grant or $10 million or 100. It's so much because it took such a long time to happen, such a long time for these problems to surface. And the thinking that we can just have a program that fixes it all is wrong. Like we need to invest in education, invest in safety, invest in prevention for children, invest in entire neighborhoods that have been
Mhm.
systematically disinvested in. So it gets very like, sometimes when I think about it, it gets very overwhelming, but I do agree that there are small good things happening.
Well, and I think you bring up a great point. I think, when we talk about a whole systemic, a whole system of behavior that needs to change, sometimes throwing. I mean, we're happy that dollars are now being invested, but the challenge also becomes is that we're really trying to change a behavior. And as you pointed out, even working with students with Champion, I mean, I think that's a wonderful school. But even the investment there, you start investing in some other educational programs, you preventive programs, workforce type of programs. There's a lot of dynamics that go into it, that actually help kind of curb the situation. And yeah, it takes investment of dollars, but I agree with you. I will say this much: I totally agree with you in that there are some good things happening, and I
Hmm.
and I think our discussion right now is a part of that good thing, because being able to enlighten people, being able to enlighten those in the faith community, and even those who are not a part of the faith community, but being able to enlighten people to be able to say, hey, here's some steps that we can do to be a little bit better in terms of our approach. Um,
Hmm.
let me give you some closing comments, and then we'll get ready to close out here. Any departing words of wisdom you can give us?
Yes, just to mental health first aid training is really, really helpful. And it's designed to work with everyday people and get them to understand and recognize the symptoms of mental health distress, including addiction. So I would highly recommend mental health first aid training. The county offers a lot of different opportunities to take it and it's typically free. And if you wanted to do it online, that's definitely an opportunity. Another thing I would recommend is get your hands on a naloxone kit
Mhm.
as soon as possible, just to be that person in your community, in your neighborhood, among your group of basketball teammates or whatever else, just to be that person that has that tool.
Mhm.
Um, and those trainings happen pretty frequently as well. And then to just learn more about opioid use disorder and harm reduction and try to kind of destigmatize it. Like I've been working in this space for a few years, and even some people in my family will tell me, oh, there's nothing you can do. Like they're always going to be like that. Like, I don't know why you're investing so much money in someone who just chooses to do things that like ruin their lives. It's a huge barrier.
Mhm.
And these are people that I talk to regularly who hear me talk about this. So I think these conversations are really important and really helpful.
No, that's great. And I really do appreciate. And for those who are watching and viewing right now, and I think one of the best things that you can walk away with is share this information with your family and friends. Have that kind of conversation, not only in your churches. I want to encourage other pastors, have that conversation during your Bible studies in your Sunday schools. Have it at the kitchen table. Maybe perhaps put the basketball game or the football game on mute. Go Bucks, but hey, put it on mute and let's have that conversation, because I think it is healthy, as you just pointed out, and that sometimes there may be people within our own community who really don't understand the kind of fight that's
Yes.
take place within somebody else's life. But the reality is that those types of things can show up even on our doorsteps. That this
Yes.
is,
And right now I just checked the Columbus Public Health website, and in 2019 there were 161 overdose deaths among the Black community,
yeah,
representing 30% of the total overdose deaths. And Black and African American people make up maybe around 24% of the population in Franklin County.
mhm.
And so that overdose death percent is higher than the percent that Black people make up in Franklin County. So it's disproportionate. So it's definitely a real and very intense and critical problem.
No, I appreciate it though, and I appreciate you supporting with the data too, because I think the data speaks to what we need to know and what we need to listen to and what we need to hear, and as we go forward. And thank you so much for taking the time out of your evening and your day to be a part of this discussion. I believe that hopefully that this discussion is going to lead others to continue to talk about it, and that hopefully we made a difference in somebody's life today.
Yes.
Again, to all of those who are watching and viewing, we want to encourage you again, take this information, share it, pass it along. We have a survey that is on this link on a Facebook page. Please fill out the survey, give us your feedback, let us know what you're thinking about, let us know what you've learned, and hopefully again, until the next time, I want to be able to encourage you, keep the faith as we keep in touch. And thank you again, and enjoy your evening. And to all of those
Yes.
who are watching right now, God bless you and God keep